Hello everyone, here we are in Cancun, Mexico to talk about AIC calcium, also known as marrogen therapy. And the purpose of this interview is to talk about how at Hope4Cancer Treatment Centers we integrate SAC into our protocols. I am Dr. Tony Jimenez, Chief Medical Officer of Hope4Cancer Treatment Centers, and we have about 30 plus years of experience in integrative oncology. Hope4Cancer Treatment Centers first opened their doors in Tijuana, Mexico in the year 2000 and here in Cancun in 2015. And it's a pleasure to have Mr. Jae Lee. Mr. Jae Lee is the co-founder and CEO of Pronuvia. Pronuvia is a U.S. company that's responsible for marketing SAC to the world, specifically to doctors. This is a treatment. This is not a supplement, it's a therapy. And so we focus on reaching out to you, doctors, so that you can prescribe and recommend SAC, teach the patients how to use it, the multiple modalities, what type of diseases or for preventive measures we could use it. So we have Mr. Jae Lee, who is also the director of the Calcium Bone Health Institute out of Canada. He's one of the directors, and this institute is focused on really studying and testing bone density and its relationship to other potential diseases, including autoimmune diseases, cancer, and actually the list just goes on and on with heart disease and so forth. Yes. So it's important to know that the Institute also is responsible for developing recommendations for protocols, the technical aspects of SAC therapy. That's so right. Thank you, Mr. Jae Lee, for being with us.
Thank you, Dr. Jimenez.
Surely. And then we have Dr. Leslie Gomez. Dr. Leslie Gomez is a medical doctor specializing in pediatrics. She was formerly the head of a pediatric unit in Mexico City and transferred to Cancun, Mexico a number of years ago, where she was head of the pediatric department also here in Cancun for 5 years, and joined Hope4Cancer in August of 2017. And what's more important is that she is also in charge and heads up the BEST program, the Behavioral, Emotional, Spiritual Therapy program at Hope4Cancer. And in my experience, this is fundamental and key to patients' recovery from cancer and chronic disease. And we'll see how SAC therapy plays a role not only in the physiology of the person, but also in the emotional aspect. Sure. So to that end, let's talk about the 7 key principles of cancer therapy that form the foundation of our treatment program at Hope4Cancer Treatment Centers. And within that, we embed the SAC therapy as a very important part of what we do. And since we started talking about Dr. Leslie and the emotional aspect of health and recovery, what has been, before we get into the technical details of SAC, because everywhere that I speak and present information on cancer throughout the world, the big topic is always the emotional aspect of disease, and knowing that the mind, the spirit, will allow the body to recover. And also for those of you that are watching, for preventing disease is very important. So Dr. Leslie, give us a little bit of your observations, your experience with the emotional, spiritual, and as what you've seen with SAC.
Of course. Well, thank you, first of all, for the invitation, and it's a pleasure to be with you both. I believe that one of the major things that I've seen that takes a lot of energy from the patients, 2 major things. One of them is pain, and the other one is energy. So if they have pain, they're not willing to do things. Their energy is so drained that then emotionally they feel also very low, they feel depressed, they feel cranky, angry, they don't want to interact with the family, people around them, they don't want to do the treatments, they don't listen very well, their just mind and their hearts are just not functioning correctly and in harmony with the body when the body is in pain, because the pain attracts so much attention from the whole being, that I believe that taking pain away is one of the things that really helps the patient to be more balanced in the mind and the heart. What I've seen with SAC basically is that patients experience less pain, and they experience, because of it, better thrive to do things and better energy, a lot more energy, and that allows them to keep doing their therapies, because it takes a lot of energy to take care of ourselves. Takes a lot of energy to keep up with the 7 key principles, to tell you the truth. And it's just a lot of work that we have not done to get to this point, that now we have to do them, and we need a lot of energy to do that. So energy is the second one. So
as physicians, one of the things that we're taught even the first day of medical school is how can you enable the patient to be compliant with their therapies, right? So what you just mentioned about those patients that are on SAC, if they're having less pain, more energy. Wow, they're going to be so compliant to the Hope4Cancer Therapy.
Exactly.
And continue with the SAC therapy, because hey, something's helping me for the pain and the energy, so I want to continue taking it. So this is brilliant.
Yes, and I think one of the things that I saw in most of the patients is they would experience that. They would experience more energy and less pain. And I think that's really important for them at the emotional level.
You also talked about, off camera, you talked about that some of the patients, including your mom and dad, and we'll talk about them in a bit, but their emotional state with respect to being more at peace, less irritable. Tell us a little bit about that.
Yeah, I was telling Dr. Tony that my mom, by 5 o'clock, she's 75 years old, so she's very active, gets up very early, she's a swimmer, but for the last couple of years, her energy had been going down the hill. Unfortunately, my dad has been diagnosed with cancer, and after his diagnosis, I think my mom focused so much on my dad that took more energy from my mom also, and she stopped swimming, and she just was not in the same style of living, right? So then she felt really cranky after 5 o'clock. She didn't want to talk to anybody. She didn't want to go out the house. She was just grumpy, in a bad mood, bad temper, kind of very like walking in eggshells really around her. So even my dad would say, I'd rather not say anything because she's like, you know? So after I noticed that my mom, she has no illness that we know of. She's pretty much healthy. But as she started taking Matogen, and like within a couple of months at the most, we start noticing a better energy, less cranky. She started getting up to swim again, and she was able to do help my dad therapy after 5, 6, 7 p.m. And she was like with her energy and her mood, because Dr. Tony knows my mom, and she's like hyper and happy and all that joy that she had, it was coming down the hill, and it's back. We've noticed that it's back, that she's happier, that she's having better energy, she's helping dad. So that helps him too, not to feel like, oh, I have to ask her to do something for me, and then he wouldn't want to ask, and that creates in the family environment at the emotional level. So if I could see that with my parents, I'm pretty sure that a lot of our patients are experiencing some of that too, where somebody feels tired and then they don't want to help the person that is ill, because it takes a lot of energy to help somebody that's ill at home. So it's not just the patient, but the people around. So I really suggest not just for the patient, but for the family to take it, because they're going to need a lot of energy to help the patient that is actually ill, and they do need it. And, it's preventive also, not just to heal, but to prevent.
And Mr. Lee, isn't it such a blessing to hear this, right? Where
It is,
it's
certainly.
just helping the quality of life.
Exactly.
And no matter how long any of us are going to live, we want to live with the best quality of life possible. So let's describe a little bit what SAC is, Mr. Lee, specifically SAC. What does that mean?
Well, SAC stands for sigma anti-bonding calcium. It does not exist in nature. It is lab-made, but it incorporates very weak, unstable form of bonding that you're not going to find in any other molecules here on Earth. But we had a technological breakthrough that made it possible. It's simply a calcium carbonate with sigma antibonding, the weak bonding, that causes calcium to be detached and be absorbed into our system in ionic form.
Okay.
So it is world's first true ionic calcium delivery system. So even though it's man-made in its delivery, it provides calcium in ionic form, which is our body's only physiologically active form. So our body recognizes it and puts to use right away. Right? It does not require vitamin D or digestion or peptides in order to bring it into our system. All the calcium that we get from either diet or supplement form, doesn't matter which form it is, it goes in as protein-bound form, which is not physiologically active right away. It's more like a standby form to donate calcium ions when certain conditions are met. Right? But the problem is, as we get older, we cannot utilize protein-bound calcium that well. So when our body needs that needed calcium ion and cannot get it, our body has to take that out from our bones. Our bone will break down, and then it will release calcium in ionic form. As we get older, we tend to take out more calcium ion, and then it ends up calcifying our body. So not only our bone will deteriorate over age, but if you see empty bone, you have to also see that heavy calcification has already happened in your system, and this cellular calcification is actually blamed for the cause of many degenerative diseases. So that's what SAC calcium is.
Because calcification is happening at all levels, right?
All of us with age naturally.
From the brain, and as Dr. Leslie was
Arteries.
saying, the changes in cognitive function of her mom,
Yes.
and then from the brain all
My
the way
dad too.
down to
Yes.
the,
Yeah.
Yeah.
every cell in the body, right?
More and more studies been really focused on calcium ion nowadays. For past 10 years, its function and how our body's deterioration that accumulates calcium in the wrong places has been the leading cause of aging and also degenerative diseases, including cancer. So by putting calcium in ionic form in certain amount, that threshold amount that can initiate certain physiological responses in our body, very unique. How SAC does that is that it initiates very strong osteoblast. So we can rebuild a bone like when we're building bone when we're younger. So whether you're 50s and 60s and 70s and 80s, now even though you may have osteoporosis, that we can significantly rebuild your bone by increasing the bone turnover. And in the due process, it actually not only activates dormant, inactive calcium to be utilized for bone building, but it also clears calcification all throughout your body. Now, when the decalcification happens at a rapid rate, what happens is our cellular functions gets all cleaned up, and it gets really healthy. Because calcification is a leading cause of mitochondrial dysfunction, and when that happens, it produces tons of free radicals that could damage your DNA and RNA and proteins, and that could also cause cancer later on. And it causes that oxidative stress, and then also it disrupts the cellular signaling Now, this is the biggest topic for actually calcium. It's not just bone and teeth, but our body regulates the concentration of calcium ion in the cellular level, extracellular level, and also in the blood level very precisely because it is used for very basic communication. It's like a machine language for our body. Right? When calcification happens, this most basic communication breaks down. And that's when cells start to do the wrong things, right? Producing wrong proteins or folding proteins in different way, and the transcription of RNA happens in the wrong place. And all these things later on contributes to the breakdown of the immune system as well. And so we're talking about one mineral that is treated completely differently than any other because of its function as the communication medium. We call it calcium signaling. Right? As we age, it happens to everybody that this calcium signaling will break down.
No wonder there's such an epidemic now of, of course, cancer, which is on the rise. 1 in every 3 females in the U.S. will have cancer sometime in their lifetime, and 1 of every 2 males.
Wow.
Heart disease, right, on the rise. Autoimmune disease. So basically, as we're listening to why SAC calcium is so important, is at the cell level.
That's
and
right.
The cell leads to tissues lead to organs to the system, the digestive system, the respiratory system,
Yes.
and then of course that affects the body. So we could make a significant impact on all body systems when we're repairing and working on that cell level. And isn't it all about information and communication, right?
Yes.
The communication and the signaling from cell to cell is what is necessary and vital for true cell health and cell repair. And that is really the focus of treating cancer with the 7 key principles. But before I talk about that, I want to give you a little bit of insight into a story I was reading a few days ago. In the Marines, the U.S. Marine Corps, dating back to the 60s and 70s, one of the ways that they had the parachuters train was for them to jump low heights first. So they would make them jump like from 6 inches, then a foot, and ultimately they're jumping from 10 feet or even 12 feet, 20 feet, and landing on their feet, right? Not on the tips of their feet or their toes or their heels, but flat on their feet. So even though these are trained military officers and soldiers, they were being trained this way to fortify their bones. Because at those times, the parachutes were not as sophisticated as now, and they had hard landing. And so this was enabling these military personnel to decrease the risk of fractures and bone damage from falls, right? And so when I'm hearing all this about the benefit of SAC to fortify bones, this is an old concept. We know how important that is, but now in 2020, we have the whereabouts, right, thanks to the work that your company has brought forth to really easily, with a product that is taken orally, it can be done intravenously, and we'll talk about that in a moment, that we can truly get bone health, right?
Definitely.
And what I see, what I see that's amazing, it's like a regulator. It takes off the calcium where it's not needed, and it brings in the calcium where it's needed. So it really regulates, and that's a big difference from just taking calcium, and actually it will accumulate in different spots where it's not really needed, and that's actually going to cause more damage than the benefit. So this is a totally different thing, which I'm really totally in love with it.
And I know Mr. Lee, I was going to
Yeah.
call you doctor, but maybe you're like an honorary doctor with this SAC technology. But isn't health and recovery from disease about the things we're talking about? It's about regulation,
Yes.
and it's about information and signaling.
Mhm.
And I know you use the term calcium homeostasis.
Yes.
Right, and that's about regulation, what we were talking, so wonderful. So we mentioned the emotional, spiritual aspect of how we can benefit from the SAC. And now, one of my favorite topics, because it's what we do at Hope4Cancer, is cancer therapies,
Yes.
right? So we call this non-toxic cancer therapies, and what better principle to talk about the benefits of SAC as a therapy. And just briefly speaking it, and we could expand on that, the benefits of SAC for a cancer patient, independently of what stage they are, whether they're just diagnosed, whether they're in stage 4, or for decreasing the risk of developing cancer. Because with SAC, we're going to upregulate the P53 gene expression. We know that the P53 is the guardian of the genome. It's literally in every tissue in our body. But cancer and chronic diseases, specifically cancer, suppresses the expression of P53. So cancer cells are like, huh. But there is a mechanism of how SAC upregulates the expression of P53. So that's beautiful and so important in the cancer treatment scenario. The second effect of SAC with respect to cancer is the ability to decrease acidity, right? And bring more alkalinity to that well-known tumor microenvironment, that cancer terrain. Because at the end of the day, in my experience, it's about the tumor microenvironment as opposed to giving chemo or giving radiation or, surgically removing a tumor. That's short-sighted. What we need to do is improve that tumor microenvironment. And SAC does that with respect to acidity. And once we have a more alkaline tumor microenvironment, of course, the immune system is like, oh, now I could do what I'm supposed to do, which is get rid of these cancer cells, maybe viruses or any other thing that is happening. So 92% of our cancer patients are stage 4, and SAC has and continues to play a big role. So give us some of your wisdom as the co-founder of Pronuvia, and maybe some case studies, information on what you've heard physicians throughout the world who use SAC with respect to cancer outcomes.
Well, it's really exciting to be part of distributing this amazing technology to a lot of doctors out there, really helping their patients. We have had amazing cases. The spectrum of cancer that SAC is effective is it's really all across, from brain cancer to prostate cancer or pancreas cancer, breast cancer, lymphomas, leukemias.
And why is that? Because we're not treating the cancer type.
That's right.
We're treating the
environment,
the microenvironment, the reasons why.
That's right. Yes.
Sorry, but I had to say
Yeah. It's really important because the way SAC works is that it works in every little cell, and it restores the function. It makes that every cell very healthy. So what happens with SAC is that, of course, if there is some acidity around the tumor, when the pH is down to 6 or 6.5, the immune system shuts down, right? And calcium ion is very effective in binding with lactic acid and neutralize it, right? And bringing the pH right back to where it needs to be, where the immune function can start its work again. And the cancer just it goes away at such a rapid rate that that moment the cancer markers can shoot up into the level that they have never seen before it just plummets. Right? So every case is different, but we had cases where the cancer patient had a tumor size of a soccer ball that's reduced to nothing.
And sometimes that sounds like, come on.
Yeah.
It's
That's
hard to
unbelievable,
believe.
right?
Yeah. Of course, every patient it's case by case because they come to us with so many different diseases all at once, and we cannot direct what ionic calcium can do to what we want. It's very sought after resource for our body. Most cancer patients have low bone density. Most cancer patients have too much calcification in the cellular level. They have calcium homeostasis broken. And there are many factors that plays along for that to happen in the first place. So for SAC calcium to address all that at the same time may take some time, but the thing with SAC is that it does is work rapidly to build your health from systemic level to the cellular level, right? It works many different levels altogether, and the results, once the disease momentum turns around, you will see how amazing our body's the healing capacity is. When we provide right environment and certain help, it is our body that heals. Right? Yeah. So I've been really blessed to see many amazing positive effects.
Well, thanks for sharing that, because as we work with the 7 key principles, we talked about the emotional, spiritual, we talked about the non-toxic therapies, of course, oxygenation, detoxification, the immune system, gut microbiome, and nutrition form the other key principles. And as we're improving cell signaling, as we're decreasing lactic acid and acidity, all these other key principles are being affected in a positive way, right? Because
I would say that
gut health
SAC is working in all of them.
All of them, yeah.
Like in little pieces, but in a very deep level.
And once we have that cell doing what it's supposed to do, there's going to be better oxygenation, the cell's going to be more nourished, the cell's going to be able to... But it's good that with SAC, obviously, we could address the 7 key principles that form the foundation of cancer treatments at Hope4Cancer. So, it's good that with one product, we could address so many pieces of the very important puzzle of cancer. Because there's never a magic bullet, and that's another important part. SAC is a fundamental piece in our treatment protocol. However, we have to work holistically with nutrition and everything else, so that's important. So with respect to diseases, we know that, as you mentioned, we've seen benefits in cancer, of course, diverse autoimmune diseases, heart disease, the neurodegenerative, right? There's so many studies and experiences with Parkinson's, Alzheimer's, MS, ALS, and others. And so let's talk a little bit about how do we use, what are the recommendations for using SAC? We have the oral way of administering and the intravenous.
Well, definitely oral is, for cancer patients, we recommend 4 doses a day. So it's mixing 5 ml into 500 ml of water. Many cancer patients or people in general do not drink enough water a day, so this will be a good discipline for them to learn to drink enough fluid. So by doing so, we're getting SAC into our system that triggers these responses. It lasts about 4 hours. So in theory, if you can put as much SAC in your system, it will actually be better. But in practice, it's difficult because it requires empty stomach. You have to take SAC and empty stomach and wait about 30 minutes for full absorption, and then you can take meal. So the good time is when you wake up when you're thirsty, take 1 dose, and then by the time you have breakfast, after shower and all that, it'll be about 30 minutes. So 30 minutes before lunch and 30 minutes before dinner and 1 hour before you go to bed, you can squeeze in 4 doses. But we do also have IV treatments. In a clinical setting, cancer patients get 2 IV drips a day. That's 10 ml. And SAC has very exponential efficacy. There's a limit that you can take SAC through oral per dose, but with IV you can push 10 ml, and that has multiplied effect. So definitely in clinics we recommend to give 2 doses IV, and then if patient can squeeze in some oral doses, 1 or 2, then it will definitely accelerate its efficacy.
So what's the difference between 10 mLs twice a day, which is 20 mLs, and then 5 mLs orally 4 times a day, that's also 20 mLs?
Yeah. Well, first of all, putting 10 ml, you can induce very, very strong response. So for cancer patients, usually they're very calcium ion deficient, and their disruption of homeostasis, calcium homeostasis, is a lot bigger. So we want to fight the disease from the get-go, right? Be able to turn around the disease momentum. So going strong in the beginning is very important. So when patients come down to the clinic while they're staying here, giving them very strong dose, because if you're putting 5 ml in 4-hour period and 10 ml in 4-hour period, the effect is not just twice, it can be multiplied, right? So you're giving that big blow to the disease by giving 10 ml, even though throughout the day it's the same 20 ml, the impact will be different.
Yeah. And I know, Dr. Leslie, that you mentioned your dad, and your dad had stage 4 prostate cancer and very high PSA. Give us a little history of your dad, and then how did you see and witness and lived his recovery, and knowing that SAC was a big part of the therapy program that we developed for him here at Hope4Cancer.
Well, first of all, my dad was we suspected of something going on in the prostate 2 years ago. Actually, 2 years ago, January of 2017 or 18. Then it was a little bit more than that. But then he's a little stubborn and he didn't want to do anything. So then time went on until August. The PSA started going up. And so we start with the core program at Hope4Cancer. He did a 4-week cycle. Normally it's 3. We did 4 on him. And the PSA was already over 1,000. So it was very high. Normally it has to be, by his age, he's 80, now he's 84, but he was 82 back then. So it should be below 15. Anyway, it went over 1,000, so we started treating him with, we did a bone scan, and we realized that the PSA was up to heaven because of the bone metastasis. So that's how we got to stage 4, right? He had a tumor in the prostate, wasn't that big, never needed to be catheterized or no urinary real trouble, but it was more in the bones. When we realized that, of course, we did, we had to do a little bit of conventional, but what I noticed then is his energy levels were very bad. He was not eating, he was hardly drinking any water, he was not doing any exercise. Mentally, emotionally, he was almost beating up. He was very sad, very tired all the time, couldn't focus. And anyway, we started Margin right away. He was very disciplined into doing 4 times a day. He's been doing that since then, and from the first bone scan to the second one, we noticed that a lot of the lesions that he had, especially, for example, he had some in the bone of the head, they were gone from 1 year to the other. So 2018 was one scan. In 2019, a year later, a lot of the lesions were gone. A lot of other places where the contrast was very high level capture. You could see it was lower. And another thing, most important, no pain at all, and no broken bones. I mean, you know, that's, and for him to have it all over the place. I mean, the spine, the collarbone, the head, the orbit. The orbit disappeared. I mean, the jaw, everywhere. Dental didn't even want to do any work because they were afraid of breaking the jaw. So a lot of those lesions are gone. So for me, I mean, there is no way my dad at that age, taking whatever, he was going to be able to heal those lesions without Metagen. I mean, that's a fact. So with that, we're so blessed. Now he's going to have another scan in August. I'm excited to see the results. We're doing one every year, and he's amazing. He's no pain whatsoever, which I was telling you about the pain. You know, it's so important for the patient to not feel pain. He likes to work a few hours a day, but he still does his work, his exercise. He goes out and walks. I mean, we were afraid of what if he breaks walking, you know? Nothing. He lives in Mexico City, and he's so...
You sent me a picture of your dad on a bike.
Yeah.
I remember that, right?
He plays with my daughter, so he has a granddaughter, and he plays with her. He goes out and chase her and ride a bike. He walks, he swims, he goes to the gym. I mean, for his age is amazing, you know,
That's
things that he
amazing.
was not doing already before the cancer. So it's just, for us, it's been amazing. And my mom taking it and seeing all these changes also. I mean, and there is just this quick thing that happened, you know. So my dad was having some heart issues, his age. He ended up in the hospital for a few days. And so the doctors were very scared about, oh no, don't take any calcium, because he said it's just calcium. And he's like, no, don't take calcium because we have to first see what's going on with your heart. So he stopped taking it. And he stopped taking it until the doctors in Mexico City would let him take it again. So that's when we noticed really like the before and after, because after over a year of taking it, all of a sudden they said, don't take it anymore. So he stopped taking it. 1 week, 2 weeks, 3 weeks, 4 weeks. All her brain functions, like the cognitive area, went down the hill. In the beginning, we thought maybe it's heart. No, because when he started taking it again, he said, you know what? I don't care what the doctors say. I'm just going to take it again because I felt great with it. And I don't care. I'm just going to take it again. I'll take one, you know, a day. I feel good. Next day, I'll take 2 and then 3 and then 4. And he started taking it. So within 5 days, he was taking it full dose and he started feeling great. Second week, he's like, okay, I'm back, you know. He's like, his brain was so foggy. He said the whole day, he couldn't accomplish anything. So when he started taking it, he started working again, and I couldn't understand when I would talk to them on the phone. I couldn't understand him, what he was saying. It was just so different. His speech was low and, you know, not right. When he took it again, all that got corrected. So that was very clear.
This
very
is an
clear.
example of
Yeah.
a very difficult situation, stage 4, advanced prostate cancer, 84-year-old gentleman, and apparently some heart problems.
Some arrhythmia, but besides that, the heart is healthy.
And he's taking the SAC. And this is a good question because oftentimes patients will ask, or the doctors will be asked, any side effects, right? So what can you tell us about that?
Yeah. Well, SAC calcium provides this calcium ions, which our body already has plenty of it. In fact, you got to have enough calcium ion for our body to function, whether it's cell division, whether it's enzyme activation, right? It just functions as a neurotransmitter, second messenger, not just bone and teeth, for your heart to contract, your muscle to work. Calcium is used for all these purposes. So you got to have enough calcium ion ready, right? Just in case you start running and then run up the stairs, your body needs that. That's why when it dips you have to take it out from your bone to replenish it, right? So if we have that much calcium ion everywhere, and if there's any drugs or medicine that interact with calcium ion, it cannot be approved as a drug in the first place. So there's really no contraindications, and there's really no side effects because our body knows how to regulate the ups and downs of calcium ion, and what our therapy provides is well within the safe range. Our body knows what to do with, right? So very safe. But then with SAC, if a patient has a lot of calcium issues, which a lot of patients do already, they may be experiencing some healing reactions, which is because it's bringing the balance, hormonal balance at times. Also, it's a clearing calcification, so you have a heavy calcification in joints, and you have problem with your arthritis or rheumatoid arthritis. All these conditions, calcium related. You're going to be, some patients will get just better, other patients may be experiencing some pain before it gets better, but that pain is actually good pain, right?
And very transitory, right?
Healing
It's
crisis,
transitory,
we call
yeah,
it.
it's a healing crisis. For some patients, just last days, some weeks, and it could be extended to several months. But usually these symptoms, about 3 month period of time, it's all addressed, and after that, it's just a really smooth cruise.
So, Mr. Jae Lee, I have a question for you. So, what's the age that you can start taking it? As a pediatrician, I would love to hear
Yeah.
something about children, right? Because, yes, a lot of moms are so worried about the calcium in their children, and you know, and a lot of them they worry about like give them milk, and I'm like, no milk, please. It doesn't has nothing to do with the calcium. So, what do you think about the
Definitely. There's an
The
old saying,
children.
Asia says, one child, one tooth. That means that the calcium needs for the pregnant mother it's huge. So SAC calcium can actually, if a pregnant mother takes it, can really help the pregnancy. And the delivery, we had some babies that born by mothers who've been taking SAC, their delivery were a lot smoother. And the babies, they start teething when they're already like 4 months, right? And then very alert. There has been a lot of studies linked to calcium ion and the mental activity, and also it's very needed when cells multiply, right? The calcium signaling, you know, if you've seen the video how the cells, everything, the spindles, everything aligns and chromosomes, it's just amazing how body knows how to do at the right time. Now we're able to hear this, all the complex language. It's all communicated through calcium signaling. So if you do not have the right concentration of calcium when the fetus is developing, then there's a bigger chance of something could go wrong, right? So by replenishing SAC, calcium ion through SAC, we helped many pregnant women, and also even the couples that could not conceive, they were able to conceive.
Right. Hormone balance.
Yes,
Of course.
yes, that too, definitely.
So we can actually give it to children?
Yes,
Okay.
we had some babies had issues, and then our product is it's calibrated to 60 kilogram body weight. So all that you have to do is just
Dosify.
yeah, you have to change it to
Fractionate.
to the baby's body weight, and it could be given through the feeding bottle. And we also helped a lot of kids who were not eating that well and wasn't really hitting their growth spurts well, to really gain their height as well, to give them full potential, as well as
Good to know.
kids with childhood leukemia.
Hormone imbalance also maybe?
Yeah, and we're able to help. Calcium ion is very crucial for balancing hormones as well.
Yeah, and so many things in the food now that really affects the children hormone immune system, because it's all connected, right? The
That's
immunity,
right.
the neurological, the endocrine, and the psychological. I mean, it's a science about all those four things connected. So if we affect one in a positive way, then we're also helping the other three, right?
That's right.
So
That's right.
that would
And
be
this is
interesting.
where the prevention comes into play.
Right.
Because SAC therapy is not only for treating cancer patients, it's also for decreasing the risk of developing any
That's right.
disease. So
Mhm.
I just want to thank you, Mr. Lee, for all this work and being here to, just give us your from the horse's mouth, right? We didn't really talk about the developer of
right.
SAC.
Right.
Maybe a few
Yes.
words about
Yes.
our scientists here.
Yes, Dr. Paul Lee. He is a brilliant scientist. His NTS research is based out of Vancouver, Canada, and he's been working on developing SAC for 10 years. It's not an easy process because still a lot of scientists are scratching their heads. Like, how is this even possible? Right? How are you able to incorporate sigma antibonding, such unstable chemical bond, stable in room temperature? But we believe that it's really a gift from God to really help people who are desperate. And Dr. Paul's heart is really using this so that the desperate patients and their family members find a new hope. And it's such a joy to work with him. And I just hope that that he has more amazing inventions like SAC up his sleeves to help more patients.
Yes. All right. Well, thank you so much.
Thank you so
Mr.
much.
Lee.
Thank you.
Thank you, Dr. Leslie.
Thank you, Dr. Tony.
Thank you.
Thank you.